The next scenario has to do with resource allocation. So the scenario goes, a hospital is dealing with a surge of patients, and there is a shortage of ventilators in the intensive care unit. Nurses must decide which patient should receive the limited number of ventilators, knowing that some patients may not survive without this life-saving equipment. Additionally, some patients may have pre-existing health conditions that put them at higher risk for severe complications. So with this scenario, you guys might have seen a couple years ago with the whole widespread infection, all that kind of stuff. Some places had a shortage of ventilators. So this is a very tough thing to do, but when it comes down to resource allocation, I'd have to just go with the numbers. Blatantly, I have to go objectively, because if you start thinking about it too much of emotions go into it, it becomes too subjective. So when it comes to resource allocation, I would say just go by the number, do the math, try to save as much people as possible. By that I mean the people that have the highest chance of getting out the ventilator, the people that have the highest chance of surviving the intubation, surviving the whole cascade of problems that they have going on, is put those people on the ventilator first, because they have the highest chance of survival. For example, if you have a 40-year-old healthy patient that just has to go on the ventilator because they're having some bacterial infection in their lungs or viral infection in their lungs where they need a temporary ventilator, versus the 75-year-old patient that's going with pneumonia on top of this virus that's happening or whatever else is happening, right? So that's the way I think we should go about things, is just look at it from a statistical standpoint, because if you get too detailed, it becomes too subjective, too emotionally invested into it. That becomes a really, really hard thing to do, because now you're looking at not just the patient, you look at the family. If this person has kids, this person doesn't have kids, this person has a wife, this guy's divorced, he's making this much money, they're making this much money. There's so much data coming in, so this has to be just done from a very, very, very objective standpoint, and just whoever can survive, whoever has the highest chance of survival, I would say allocate the equipment for that population.